Hello, my name is Minnie and today I'm going to talk to you about fractures. Raise your hand if you have ever had a fracture. Now raise your hand if you know anyone who has ever had a fracture. Believe it or not, according to the Centers for Disease Control and Prevention, fractures are common, and the average person has 2 during a lifetime. I am a registered nurse and have worked on the orthopedic unit for over 4 years. When I tell other medical professionals that I work on an orthopedic unit, they always cringe. They say that orthopedics is too hard. They feel overwhelmed by all the devices, the movement precautions, and the pain medication schedules. With my experience, I believe that nurses are scared of orthopedics because they have not been educated enough about the topic. I think if given the proper basic knowledge of fractures, more nurses would enjoy caring for the orthopedic patient. Today, I would like to give you a little background into the types, causes, and treatments of bone fractures. First, I want to discuss the different types. 2 main types are there is closed and then there is open. The closed is when the fracture happens within the skin and there's no puncture. The opened is where the break actually punctures through the skin and leaves an open wound, which is a little more prone for infection. Here are some other types. The transverse is when the break is horizontal. Oblique is when it's sloped or curved. The spiral fracture happens with some excessive twisting to the bone. Comminuted fracture is when it fractures into a bunch of different pieces. Pathological fracture is when there's a type of disease that makes the bones weak and more prone to breaking. The green stick and the torus are fractures that usually happen within children, and then there's the compression fracture. So, according to OrthoInfo, written by the American Associates of Orthopedic Surgeons, the most common causes of fractures are trauma, osteoporosis, and overuse. As far as trauma goes, of course, there's always the fall, motor vehicle accidents, sports such as football. Osteoporosis usually happens in the elderly, but it's a disorder that weakens the bones and makes them more easily to be broken. There's also overuse. This is because repetitive motion, like maybe running or in sports, weakens the muscle, and then the force that happens to the bone makes it more prone to being broken. And this is also referred to as a stress fracture. So, when someone has broken a bone, they come to the hospital. First thing the doctors are going to do is do an x-ray, figure out the type of fracture they have, the location of the fracture. Then based on this information, it's are they going to need surgery or not surgery? So, as far as surgical repair goes, one of the surgeries is an external fixator. So basically they go in, they put the bone back together, which is called reduction. They're going to place pins and screws above the fracture line and below the fracture line. Then on the outside of the skin, they place a bar and attach the pins and screws to that bar, which allows it to stay in place while the bone heals back together. There's also what we call an ORIF. It's an open reduction internal fixation. So basically they do everything we just talked about on the inside. So they're going to go in, they're going to open them up, they're going to reduce the bone, plates and screws are going to be put in, and then they're going to sometimes even insert a rod into the bones to keep everything in place so it can heal. As far as non-surgical repair goes, there's closed reduction, which is basically, again, putting the bone back in place from the outside of the skin. And then they need to immobilize the area with like a cast or a splint, something to keep it put in place so it can heal together. They also usually order physical therapy, exercises to maintain the muscle strength, the motion, and the flexibility. And then finally, there's pain management, of course. They're included narcotics such as Percocet or Vicodin, anti-inflammatories, such as Toradol, which will reduce the inflammation, which helps with pain, muscle relaxers to help prevent muscle spasms, and then of course cold therapy. They always say that cold is the best friend to a fracture. Well, now that I have dazzled you all with some basics on orthopedic fractures, who is ready to come join me on the orthopedic unit? Well, even if you're not ready to become a permanent member of our team, you will be able to care for orthopedic patients without feeling so overwhelmed. We have discussed the various types of fractures, main causes, and different treatment measures. With this basic knowledge, hopefully you will feel a little more comfortable and confident with your nursing judgment when floated to the unit. I love being a nurse. I love being an orthopedic nurse. Now I hope when you work with our patients, you will love them too. Thank you.